I really like the response I'm getting from my videos. I definitely caught some flack from viewers when I went through my drug regimen for treating high blood pressure. So today I thought I would clarify how I manage blood pressure before resorting to the drug therapy. Now, blood pressure is critically important as it is a major risk factor for heart attacks, heart failure, strokes, and kidney disease, all of which are major killers in our culture, and they maim people as well. Now, there are many things in our diet that are going to help, so we want to have as a baseline a natural foods diet. One of the keys is vegetables. Now, I prefer organic, and a large portion of the vegetables should be raw. Now, vegetables have been shown in many studies to lower blood pressure. They do this through the beneficial nutrients they contain, which big ones are magnesium and potassium. They also have a multitude of phytochemicals, some of which we may not even have identified yet. Now, the benefit of organic is that they have better taste, they tend to have a higher mineral content, and then certainly they'll have fewer toxic chemicals. Now, studies have shown that consuming 4 stalks of celery per day has the same effect as a blood pressure lowering drug. Isn't that amazing? So it's really a no-brainer that we should start with vegetables. Now, I find the easiest way to get a dose that has an impact is juicing raw vegetables, and we'll have a video on how I do it later on. The other part about the diet is getting insulin resistance under control. Regular exercise is one of the keys. When we exercise, we burn out the liver and muscle glycogen stores that we have in our body, and these are replenished from our diet. So if we don't exercise, all the carbs and fats that we eat will tend to be stored as fat, which promotes insulin resistance. Insulin is part of a cascade that makes our arteries stiff and raises the blood pressure. Now, the other important factor to remove refined carbohydrates from the diet, especially high fructose corn syrup. Now, a food that's helpful for improving insulin sensitivity and raising metabolism, as well as burning abdominal fat, is the use of coconut oil. And I made a video about coconut oil before. Now, another important factor for achieving optimal blood pressure is to have adequate vitamin D stores. Now, the best way to get vitamin D, we all know, is safe sun exposure. Now, we can also get vitamin D from animal fats. Now, if we're resorting to a supplement, I recommend something natural like fermented cod liver oil, which is traditionally prepared and it has vitamin D3. Now, you can also take vitamin D3 supplements as another alternative. Now, the omega-3 fatty acids in the diet have been shown to correlate with normal blood pressure. But studies of taking fish oil supplements have been more conflicting. So I believe the ideal way to get your omega-3 fats is from fish directly, as opposed to the fish oil capsules, because they're processed. And how do we know if they might not be degraded or oxidized? Now, calcium in the diet has also been shown to improve blood pressure. But as I've talked about before, taking calcium tablets has been shown to increase heart disease risk. That's why I recommend calcium sources to be from raw dairy, vegetables, and bone broths. Now, another lifestyle factor that affects blood pressure is having a belief in God and to believe that your life has a purpose. There's been over 300 studies documenting this effect. You know, if a person believes that life is just an accident and life on this planet is all there is, they'll tend to have a higher blood pressure than someone who believes there's a loving creator. Now, many studies show that poor sleep also contributes to high blood pressure and obesity. So we want to identify and treat sleep apnea and treating sleep apnea is actually a treatment for high blood pressure. Now there's many natural compounds that can be used to treat high blood pressure. One of the drugs I use, reserpine, that I talked about in the other video, was originally extracted from the Rauwolfia plant. Vitamin C, which we get from fruits and vegetables, but can also be taken as a supplement, anywhere from 500 to 2,000 milligrams per day, treats high blood pressure. Coenzyme Q10 has been shown to lower blood pressure at a dose of 100 to 200 milligrams a day. A dietary source of coenzyme Q10 is found in organ meats, which I recommend that we try to get into our diet on a regular basis. The traditional diets of most primitive humans had organ meats. Now, garlic has been shown to lower blood pressure, and I try to add garlic to most of my recipes. Now, the polyphenols in many plants like cocoa improves blood pressure. So get out the chocolate. Just avoid commercial products that contain high fructose corn syrup, which raises blood pressure. Hawthorn is a plant that has a drug-like effect to lower the blood pressure as well. The flesh of certain fish, such as the bonito, have peptides that lower blood pressure like a drug does. And actually, that's one of the major treatments for high blood pressure in Japan. Now, there's many things that are taken and can raise the blood pressure, drugs, and also alcohol. Certain drugs that are important blood pressure raisers are birth control pills and the anti-inflammatory medications. So you see, there are natural ways to lower your blood pressure, and the drugs are a last resort. But there are patients that their blood pressure, despite the lifestyle changes, still have elevated blood pressure, and we don't always know what the root cause is. Thanks for watching. This is Dr. G. Have a great day.